Good afternoon and welcome to today's COVID-19 media update. I'm Heather Fairbairn. I'll be your moderator today. Before we begin, allow me to introduce the Honourable Iain Rankin, Premier of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Take it away, Premier.
Thank you, Heather. Good afternoon, everyone. As you know, yesterday we announced our first death due to COVID-19 since August. I extend my deepest sympathies again and those of all Nova Scotians to the family. I'd hoped that I wouldn't have to deliver such sad news, but it is a stark reminder that we need to continue to be vigilant with this serious disease, COVID-19. Now for the case update. 3 new cases of COVID-19 are being reported in Nova Scotia. All 3 in the Central Zone, and all 3 are connected to previously reported cases. As of today, we have 17 active cases of COVID-19. The labs completed 2,549 Nova Scotia tests on March 18th. We continue to have low case numbers in our province, and we know that restrictions have been difficult for people and businesses in our Amherst border communities. Therefore, given the low case numbers, effective at 8 a.m. Saturday, New Brunswick residents coming to Nova Scotia will not have to self-isolate. And Nova Scotians who travel to New Brunswick when they return home will no longer have to self-isolate. Dr. Strang made this recommendation based on the very similar epidemiology in both provinces. I know this will make life easier for Nova Scotians who have family in New Brunswick or who work in New Brunswick. Our low case numbers also mean good news for HRM. I'm pleased to announce that we will be lifting the remaining restrictions in place for HRM and surrounding communities effective tomorrow at 8 a.m. as well. Dr. Strang will give you details, but I want to provide some of the highlights. General visitors to long-term care facilities in HRM will be able to resume tomorrow morning. This is along with the already allowance of designated caregivers and volunteers. Social gatherings, special events, and festivals hosted by a recognized business or organization can once again happen in the affected areas as of tomorrow morning. They can have 150 people outdoors and 50% of capacity to a maximum of 100 people indoors. We're also making a change province-wide to allow restaurants and bars to serve food and drinks for an extra hour until 11 p.m. and closing to in-service service at midnight. This is good news for businesses at the service sector that have been hit the hardest by COVID-19. And household gatherings will be increased from a maximum of 10, including the household, to the household plus a maximum of 10. Now for an update on vaccine. At Tuesday's COVID briefing, we plan to give you an update on our vaccine rollout and what the next few months will look like. Dr. Strang will host a technical briefing for media beforehand. But for today, I want to share a few things that can't wait till then. We had a record high vaccination number on Wednesday when we had 2,800 vaccines delivered in arms. This week we had 7 community clinics running. Next week 3 more will join online for a total of 10. And there are still appointments open at 4 of the community clinics: IWK, Halifax Forum, Truro, and Yarmouth. If you are 80 and older and born between January and August, if you can, please get out and book an appointment for those locations right now. On Monday, we are opening more booking appointments for all 10 clinic locations. These appointments will be open to all Nova Scotians over the age of 80. Those born between September 1st and December 31st can now start booking as of Monday. We're also bringing 15 pharmacy clinics online Monday for those aged 80 and older. They are spread across the province from Yarmouth to Bedeque. If you or your loved one has not yet booked an appointment, please do so. On Monday, you will have even more options closer to home. Yesterday, we expanded the age range for those eligible to book at one of the 25 clinics offering AstraZeneca. All those HRM-based clinics are now full, but there are still a few thousand appointments in the rural locations. So if you're between 60 and 64, you can book your appointment today. Some of these clinics start as early as this weekend, with all 25 clinics running this week. We're well on our way. Over the next several weeks, we'll be getting more and more vaccine, bringing more and more clinics online. Nova Scotians will be able to get vaccine close to home from a variety of locations. And of course, this is all dependent on the supply from the federal government. It is a monumental collaborative effort that has never been done before. So our request of you is simple. Please be patient, and when it's your turn, book your appointment and get your vaccine. Lastly, the premiers of all four Atlantic provinces announced yesterday the Atlantic bubble will be coming back by April 19th. Provided epidemiology is good and public health in each province supports it, citizens will be able to travel freely across the borders of Nova Scotia, PEI, and Newfoundland and Labrador without having to self-isolate. This is important for families and for the economies and tourism industries of all four of our provinces. Allowing the safe increase in visitors to Nova Scotia will significantly benefit our tourism industry and local businesses. With an Atlantic bubble, strong public health measures, and low case numbers, we know that Atlantic Canadians will be eager to visit us. Thank you, and I'll turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. I also want to start today by acknowledging the person who died this week due to COVID-19, and my sincere condolences go to the family and the loved ones. We now have lost 66 Nova Scotians to this virus, and I hope we all choose to honor them by getting the vaccine when we are able. By doing that, we are protecting ourselves and others from the very real threat posed by COVID-19. As the Premier noted, we are in a very good position with our epidemiology. So much so that there are plans to reopen the Atlantic bubble later in April, and we are opening the New Brunswick border to people coming from New Brunswick and Nova Scotians returning from New Brunswick starting tomorrow at 8 a.m. We're also loosening the remaining restrictions in place in HRM and surrounding communities, as the Premier has outlined, and we're making a few changes to the province-wide restrictions. These will all be effective tomorrow morning at 8 a.m. Now, here are the changes to the province-wide restrictions. The general gathering limit remains at 10 for indoors and outdoors. But we are expanding the number of people you can have close contact with in your home, and that's without wearing a mask and maintaining physical distancing. I know this is especially welcome news for large families. So starting tomorrow morning, you can have your family or household plus an additional 10 visitors in your home. I know that you're probably excited about this, but I would ask that you continue to limit the number of large gatherings in your home and keep your social contacts consistent. In addition, immediate family members who live together in the same household can also be together outdoors, even if there are more than 10 people. So, for instance, a large family of say, 12 people, a couple of grandparents and parents and children, if there's 12, let's say 12, they could all go to the park together. We're also saying that now restaurants and licensed establishments can now continue seated service for till 11 p.m. and need to close for in-person service by midnight. Fitness facilities need to continue to operate at 75% capacity, but can return to 2 meters between people for all activities. Up till now, they've had to require 3 meters between people for high-intensity activities. Lifting the restrictions in the Halifax area means that everyone across the province now follows the same rules. There can be social and special events and festivals, as well as meetings with the same gathering limits province-wide. So, for example, there can be weddings with receptions and funerals with visitations or receptions across the province. People can visit loved ones in long-term care facilities. So we're opening up in the Halifax area, along with the two designated caregivers. There can now be a return to other visitors as well in the Halifax area in long-term care. So all of these restrictions and more details will be listed on our coronavirus website. Nova Scotians have worked extremely hard to be in the position we're in today, and I want to thank all Nova Scotians for that. I recognize it has not been easy, but your ongoing support for these public health measures is what continues to make Nova Scotia one of the safest places in North America. But we cannot forget that things can change quickly. And until the majority of Nova Scotians have received their first dose of vaccine and we have a high level of protection from the virus, we will need to keep following all of the COVID protocols and using restrictions as necessary. These are the things that have kept us and our community safe, and the next 2 to 3 months are critical, and I know we are up to the task. Speaking of the vaccine, if you're eligible but you haven't booked yet, please do so. We acknowledge we have had a few bumps in our online booking system and our toll-free phone line, but for the most part, we are hearing that using these is both relatively quick and efficient, and when we are having some challenges, they are being fixed in a very timely manner. I do know that the phone lines have been quite busy, and we've heard of people calling and just getting a busy signal. Yesterday, the number of spots for people to wait on hold was increased, and this will help, but there still may be a wait once you're in the queue on the phone line. And we're working, so by the middle of April, we'll be setting up another call center that will have nearly double the capacity for online booking. But my team has asked me to pass on a couple of tips about people who are looking to use the toll-free line. If you're billed by the minute on your phone, consider booking online so you don't get charged by your phone provider while you're potentially waiting on hold. And also, we know that the peak times for the phone line are in the morning and in around supper time. So if at all you're able to, choose another time. Mid-afternoon and after 6 p.m. tend to be less busy on the phone line. I won't say much about the vaccine today, but as the Premier said, we'll be giving an extensive technical briefing next Tuesday. But I do want to talk for a moment about AstraZeneca. There continues to be media coverage about the adverse events associated with this vaccine coming from Europe. There have been some very rare cases of unusual blood clotting, 25 cases and 9 deaths out of about 20 million people vaccinated in the European Union and the United Kingdom. At this time, it has not been determined that these events are caused by the vaccine, but that is a possibility, and analysis is ongoing. I can say that as of now, there have been no similar events reported in Canada, nor have there been similar events reported with the mRNA vaccines, Pfizer and Moderna, anywhere in the world. The European Medicines Agency and the UK Medicines and Healthcare Products Regulatory Agency, the groups responsible for the scientific evaluation, supervision, and safety monitoring of vaccines in the EU and the UK, are advising that the benefits of getting the AstraZeneca vaccine outweigh the risks associated with these rare adverse events that are being seen. And Health Canada reached the same conclusion late yesterday. If you are looking for more information before booking an appointment for the AstraZeneca vaccine, and to know what you should be watching for after receiving this vaccine, we now have more information on that on the vaccine section of our coronavirus website. In closing, I want to wish everyone a relaxing and safe weekend. We have come a long way together over the past year, and while there is an end in sight, we have a few more months on this journey. We have the lowest per capita rate of COVID-19 in Canada, except for the Yukon, and by caring for one another, we can keep it that way. Heather.
Thank you, Dr. Strang. We'll now take questions first from the room, then from the phones. We'll do one question, one follow-up in the time we have allotted, starting with CBC, Shayna Luck.
My questions are both for you, Dr. Strang. Every other province in Canada has said it will prioritize people with underlying medical conditions, even our neighboring Atlantic provinces. You've told us that would slow down the rollout. So I'm wondering, why aren't we pulling in more resources to make that rollout go faster?
So what we have, and we'll talk much more about this on Tuesday at the technical briefing, we have extensive resources, and which allow focusing just on age. It's not just about resources and numbers of people to give vaccine. If you're focusing on specific groups, you have to have a process to set up different types of clinics. You have to have a registration process that you validate people, whether it's can you validate their occupation, can you validate their health condition. All of those mean that you have to then have many more streams to your vaccine program. Setting all those up and running them actually divides up your attention and time. We've looked at this extensively, and again, we'll talk more about this next week, that we're in a position in our stream that we will get by middle of June all Nova Scotians who want to get vaccinated the opportunity to get vaccinated. If we start to accommodate different medical conditions and others, that slows us down. We're in the fortunate position, it's not just the risk of severe disease, but what's your risk of being exposed in the first place? And in Nova Scotia, that's extremely low. So nobody's been put at any substantive risk by us following an age-based approach. If our epidemiology somehow changes, we will adapt our program. But I'm very comfortable, and I stick that our best approach to get the most number of Nova Scotians immunized in the shortest period of time is this focused age-based approach. And by doing that, as we build that population immunity, all the people who are still waiting for vaccine are being protected anyway as you're building that population immunity.
I hear you've told us many times about the speed of an age-based approach, but we are still hearing very deep frustration from people who are, for example, seeing groups like the police officers moving to phase 2, whereas people are telling us they're not seeing cancer patients move to phase 2. What can you say to those people?
So recognize everybody has their concerns. People have unique risks and unique needs. But when we look at, my job is to look at the entire population and what's best for the entire population. And I'm very comfortable that saying an age-based approach is the best approach for all Nova Scotians. And it actually puts those people that we're protecting them, even if they're not yet immunized, protecting them by rapidly building population immunity. Many of them aren't going to respond as well to the vaccine, so they need that other layer of protection around them. So we're building that up, and many of them they'll get the quickest. Many of them, as their age cohort comes up, many people with chronic conditions are in the older age groups anyway, so they're going to get vaccinated faster than if we try to divert to a range of different types of occupations and medical conditions.
We'll now go to All Nova Scotia. Lindsay Armstrong.
A question for the Premier. I'm wondering if you can help me understand the month delay between this meeting with the Atlantic Premiers and when the date is expected to start. I'm wondering if that's because you're not comfortable with the current COVID levels recently. Are you looking for them to drop? I'm also hoping if you can clarify what by April 19th means. Is it possible that it could happen sooner?
Yeah, we were all collectively comfortable with putting a date that would be, in our view, the latest. So April 19th is the latest that we're looking at. But if our epidemiology remains and there's more comfort from all of our, obviously we need consensus across the board. So if we were to have that earlier on, then we could lift that restriction earlier.
Dr. Strang, I'm hoping you can walk us through the situation where police made a case for early vaccination after your comments last week saying that frontline officers are not at a higher risk.
So we were in conversation with police. We were for a number of weeks. I was involved with them, and what we're doing is actually we became more aware of that for many frontline police officers, they may be the first on scene for a medical event. So all we're doing is treating those frontline police officers the same as we're treating medical first responders, who are the firefighters who have advanced medical training and therefore, especially in rural areas, may be the first on scene, and paramedics, who are often the first on scene for a medical event. So we've made the decision that all our emergency first responders who have the potential to be first on scene for a medical event, whether they're police, fire, paramedics, are going to be treated the same in terms of their access to vaccination.
Halifax Examiner, Tim Bosquet.
Yeah, coming back to, the trying to, you said it would delay things by saying this group or that group moving up. I get that public health has its specialties, and Nova Scotia Health Authority has its ability to get, to vaccinate people, but there's a giant bureaucracy out there that's not under those. Access Nova Scotia. Those are people who can do chores like that. I guess I'm just going to reiterate Shayna's question, which is, given the resources, couldn't you do this?
You can't just plug anybody into a vaccine clinic and give vaccine. We have large numbers of people that are administering vaccine. We're also doing this within our vaccine supply. But again, you'll see much more in this next week. Focusing on an age-based approach, we get very soon, within the next few weeks, we're on a very rapid trajectory of rapidly adding, decreasing age cohorts in. The process we've chosen will get us to middle of June for all Nova Scotians. It actually goes us by end of May for people at about down to about age 30. So I'm very comfortable, given our epidemiology, nobody has been put at any substantive risks by us following an age-based approach. If our epidemiology changes, then we may have to switch. But this is the most efficient, effective way. The goal we have is to build population immunity as quickly as possible, and that means that we have to take the approach that allows us to get the most number of people immunized, regardless of their health status, regardless of what work they do, get the most number of people immunized as quickly as we can.
I got to tell you, after we reported yesterday that police had been moved up to phase 2, thousands of people have responded saying things like, oh, male-dominated police get moved to the front of the line, but the female-dominated teaching profession who deal with hundreds of kids every day without masks, their concerns get ignored. On and on and on with different professions, different people with health needs. Are you concerned that that single action may have built distrust and anger at the entire vaccination program?
So, and it's unfortunate that the way it's been understood. As I explained earlier, this was simply about, as we get more understanding of frontline police officers and their potential, because of their work, they have to, if they're first on scene, they have to respond to somebody in a medical crisis. So all we're doing is treating the frontline police officers the same as we've done with medical first responders, the subset of firefighters and paramedics. We're not treating them special in any way. We're treating them equivalent like we're doing with other emergency first responders. For all other occupations, again, Nova Scotia, there's very little risk of being exposed to COVID, so our way we're dealing with all occupations and all medical groups is an age-based process, because that allows all of them to get immunized the quickest and will protect them even while they're waiting for vaccine.
Now we'll go to the phones, starting with CTV, Natasha Pace. Natasha, are you there?
I am, yes, thank you. I just wanted to check in on the vaccine. I think last time we spoke, the idea was that we were expected to get 50,000 doses of Pfizer and Moderna next week. Can you just confirm whether or not that is the case and how that will kind of ramp up the rollout?
I don't have the numbers in front of me, so I believe we're still on track for that. I think next Thursday we're getting that, but we'll be going into much more detail at the technical briefing on Tuesday about what the next number of weeks look like in terms of vaccine and how we're expanding the range of access and the range of clinics.
Okay. Premier, could you also talk about why now is the right time to open the border with New Brunswick? Obviously, we're about a month away or less than that from the Atlantic bubble, so why is now the right time?
Certainly, I think New Brunswick is doing very well, very similar. When you look at our epidemiology, there are virtually no differences in our two provinces, and likewise with PEI. So we've been talking about this for a number of days, and when I broached the topic with my colleagues in other provinces, it became a discussion about what an Atlantic bubble would look like. So we're looking at that in April. But if we have comfort in our province for New Brunswick, as we do for PEI now, there's no reason to wait.
Next, we'll go to Global with Alicia Draus.
Thank you. This question is for Dr. Strang. I understand that you've already answered a number of questions just in regards to trying to not slow down the process of getting vaccines to people by, adding in careers or medical conditions. I'm just wondering, does this mean then, because other provinces are taking a different approach, will our rollout actually be faster than other provinces?
So I'm not comparing ourselves to other provinces. We're doing what is best for Nova Scotia and what we, as we develop our program, what we know that we can roll out the fastest. For the last year, I have not concentrated on comparing myself to other provinces. We've made decisions that are necessary in Nova Scotia, and I think our record shows that the decisions we're making are putting us in a very good place.
Alicia, do you have a follow-up?
Yeah, I'm just wondering if you have any details about maybe when we'll receive the Johnson & Johnson vaccine. And I know that you had mentioned earlier this week that we'll start vaccinating the homeless population with the mobile clinics. Will we get the Johnson & Johnson vaccine in time to maybe give them to that population, considering it's only a one-dose vaccine?
We're starting the homeless very early in April. We have had no confirmation yet of any date or even amount of Johnson & Johnson yet from the federal government. So if we're fortunate and we get Johnson & Johnson, we'll potentially use it. But we're moving ahead with starting immunizing our homeless populations early in April. And we'll use, if we have mRNA, we'll use that mRNA vaccine for 2 doses. And if we have Johnson & Johnson, which I don't believe we will have, but if we somehow get it, then we'll use that.
Next, we'll go to Canadian Press, Keith Doucette. Keith, are you there?
Yes. Good afternoon, Dr. Strang. I'm wondering, we're starting to hear, we're not starting, but we've been hearing for some while now about this third wave that's variant-driven, especially in Europe. Many countries are locking down yet again. There's real concern about multiple variants in the United States. We're seeing it in other parts of Canada, and yet we still don't seem to have a large prevalence of it here. How much of a concern is it, and is it a mystery to you that we've not seen more variants in the Atlantic region and in Nova Scotia in particular?
It's not a mystery. I think we've been able to have limited introduction of COVID virus, whatever variant, for the last year because of a number of factors. Key one of those is our 14-day quarantine that's required in our border restrictions. It's critical that we maintain that for travelers coming from outside of Atlantic Canada. And then all the other public health measures that when we do get cases, we wrap around and act very quickly. It's also a reason of why I'm very much focused on getting as many people immunized as quickly as possible. That is the best we need to add that high level of population immunity is the next layer protecting us against any if we do get a variant strain. Because even if a variant does get introduced, if we have high levels of vaccination, it's going to have limited ability to spread. So again, we've got existing measures in place that have kept us safe for the last year, and we need to maintain those for the next 2 to 3 months while we build population immunity. That is our defense against the variant.
Keith, do you have a follow-up?
Yeah, so what would it take if the variant shows up for you to shut things down really quickly? Is there a number in mind, or some kind of a cluster that would prompt you to shut things down quickly, given that I get what you're saying in terms of the vaccinations, but by the time we reopen again the bubble, the bulk of those vaccinations will not have been done. We're still going to be in the process of that. So how quickly would you need to shut down if you see something bubbling up?
So, I mean, we will act. We've done it before, and if we need to, we'll act quickly again. We do have the variant here. We've had both the South African and the UK variant, and we have active cases right now that are linked to variant cases. But they're not spreading because I believe that we've got good measures in place, and Nova Scotians are continuing to practice all the public health protocols. So physical distancing, masking, all those things, they're not just variant specific. They prevent the spread of any coronavirus, regardless of the variant. So that's why we need people to continue to do what they're doing. We do have the variant here, but it's not spreading because we've got the right things in place. The quarantine, the border measures limit the ability of variants to come in here. But if we do see, I mean, that was one of our concerns several weeks ago when we acted very quickly and put restrictions in the Halifax area, because one of the factors we were looking at was a significant growth in the number of cases with lots of contacts and the potential for variant. So yes, we will act very quickly if we get a sense of the need to do that based on the epidemiology. But we do have two things. We do have the variant here, and this is why I have to say it again, we need to continue to practice all the public health measures, use restrictions as necessary while we build our population immunity through vaccine.
Next, we'll go to Chronicle Herald, John McPhee. John, are you there?
Yes, I am. Thank you. Premier, you said that it's too early to give a possible date on allowing tourists from outside the bubble into Nova Scotia, but do you have any criteria in mind for that to happen? For example, a certain percentage of vaccinated people from a particular province, they can get in, that kind of thing?
No, there's no, I don't think, guidebook to how we figure that out. We're just focused right now at our region. I think it's really positive that we've done so well that we can open back up to the bubble that has served us well in the past. So looking forward to being able to see commerce happening across our maritime region and through to Newfoundland eventually in April. But I won't start discussing that until we move forward with more vaccines and our epidemiology remains low through the bubble exercise.
John, do you have a follow-up?
I do. This is for Dr. Strang. Did I hear you correctly that you hope to give all Nova Scotians an opportunity for a COVID-19 shot by mid-June? That appears to be a big change from the fall. So I'm just wondering if I heard that correctly amid the fire hose of information we've had today.
So we've been talking for several weeks that as we've shifted from being able from our holding back the second dose now to being able to use all our vaccine for first dose, we've been saying that would put us on a trajectory for getting everybody immunized by June into June. We'll present more details on Tuesday, but we're now on a projection. And again, we have to remember this is always dependent on the supply of vaccine from the federal government. But if we get the vaccine that we're expected to get, and our modeling is based on a 90% uptake of vaccine, we would be in a place where everybody, all adults, would have the ability to get their first dose of vaccine by the middle of June.
Next, we'll move on to the coast. Victoria Walton. Victoria, are you there?
Yes, thank you. This question is for Dr. Strang, just about the opening up for vaccine spots. Do you know how many of those original 13,000 were left when they opened it to the 60 to 62-year-olds? And if there were, how many were left? How many of those still remain that are able to be booked?
But we knew there was one clinic in sort of southwest Nova Scotia that only had 23% capacity as of yesterday. So that's one of the reasons the key reason we're opening up now to 60 up to 60-year-olds, 60 to 64. That we need everybody. We need those clinics to be at 100%. We don't want vaccines sitting there unused. So we're opening up the age group effective today and get more people online booking the clinics. These are for the AstraZeneca clinics.
Victoria, do you have a follow-up?
Yeah, this question is also for Dr. Strang. Just some, reassurance for people. There have been a lot of people in that 70-year-old age group who are saying, when's it going to be my turn? So just what would you say to all of those people who are kind of, feeling a little like they're in between the AstraZeneca and the people who are right now getting the mRNA vaccine?
Very soon in the coming weeks, they'll see much more detail and confidence about when they're going to get vaccinated. Again, the technical briefing on Tuesday. We're just putting together some of the final information and agreements on things, so we can't present that today. But I'm kind of going to assure people in that 65 to 80-year-old group, you are going to get access to vaccine very soon.
Moving on, we'll go to CBC. Jean Laroche. Jean?
Good afternoon, Dr. Strang. You have repeatedly said, and again today, that using age is the best and quickest way to distribute this vaccine. But according to a vaccine tracking site I'm sure you're aware of that uses the government figures, Nova Scotia is dead last in the country when it comes to distribution, whether you're measuring it by cases or vaccinations per 100,000 or as a percentage of the population. The site is basing that on the number of people who have been vaccinated, not the doses. The Government of Canada site also using data, but it's a little older, saying the same thing. So if this really is the best way to vaccinate the most people the quickest, why are we dead last in the country according to that data?
So that's reflective of simply we made the decision that when the NACI recommendation was that people should get their second dose of vaccine 21 to 28 days after their first dose, we were in a position because of our very good epidemiology that we could follow that scientific recommendation, and we have been holding back that second dose. We are now, once NACI changed their recommendation, we have moved away from that, but we had large numbers of people who, when they gave their consent to be vaccinated, they gave it on the knowledge that they were going to get their second dose 21 to 28 days later. We are honoring that consent. It would be ethically wrong to change it on them now. So it'll be very early in April when we finished up all those people who have been promised and will get their second dose of vaccine. And again, you'll see this, I keep saying, wait till next Tuesday. Once we get that and we get much more supply, our vaccine, uptake of vaccine and the number of Nova Scotians who get immunized will significantly increase. But what we're seeing, other provinces that didn't make the same decision. And frankly, they had people that couldn't get a second dose because when we had shortages of Pfizer and Moderna, but we were able to accommodate that second dose because we'd held it back. So we're simply, I take a longer term view on this. To me, the vaccine, it's the end goal is getting all Nova Scotians the opportunity to get immunized, and that takes several months. I'm not really concerned about where we are now compared to other provinces, because I know we're on a trajectory to be very effective in getting all Nova Scotians over the next 2 to 3 months.
Jean, do you have a follow-up?
I do. There's also a lot of frustration, Dr. Strang, coming from people who are 80 plus and are seeing people decades younger being vaccinated ahead of them because the province hasn't expanded the AstraZeneca vaccine to them. Could you tell them why that is?
The recommendation from NACI, I think it's more complex. On the one hand, they said, yes, people over 65 could get the AstraZeneca vaccine, but they also made a preferential recommendation saying that people who are at increased risk of severe outcome, and that is people who are you start at about age 65, that they should preferentially be offered the mRNA vaccine. So, which means that those folks between 65 and 80, that they should be preferentially offered an mRNA vaccine, not the AstraZeneca. So we're not opening the AstraZeneca for those age groups because we know that we have very good epidemiology. The risk of somebody 70 being exposed is minimal, and that we're going to get them vaccine with the preferred vaccine, mRNA, in the next few weeks.
We have a few minutes left, so we'll come back to the room for one question each, starting with Shayna.
Dr. Strang, I'm wondering if you could tell us more about how you're judging whether we're moving fast and efficiently enough. I think I heard you mention that you're hoping in the middle of May we'll be down to age 30, if I heard that right. Can you give us a more detailed breakdown of the age markers that you want to be hitting and when?
You'll see that on Tuesday. We have a whole bunch of graphics that will show you as we're moving for those 5-year increments. We're very soon going to move into the 75 to 79-year-olds and the 70 to 74-year-olds. We'll move that through very quickly through April and May and into June.
Not till Tuesday?
We're still working on some of that. We got to firm up some of the details, and we're talking about clinics and making arrangements. So much more information to come at the technical briefing.
We'll go to Lindsay, all Nova Scotia.
Yeah, following on Jean's question, I understand that the over 65 crowd should be offered preferential access to an mRNA vaccine, but if potentially these people are feeling at risk now, why should they not be able to have that option, like the 64 to 60 crowd, in signing up for an AstraZeneca shot, recognizing the risks themselves?
So the reality is we only have 13,000 doses of mRNA vaccine. So, to divide that up and to have that choice at all our clinics, you'd have a handful of doses of vaccine at any given clinic. It's just not efficient or effective to do that. if we got more AstraZeneca vaccine, and we'll have to see what we get down the road, we might be able to do that. But by the time we get that, we're going to have lots more mRNA vaccine as well. The reality is that the best thing to do with AstraZeneca is very challenging given small amounts and then the age restrictions. And once we open it up to that 60 or 50 to 64-year-olds for the very small amount, it makes the most sense just to keep it to that and move quickly through as quickly as we can for the older age groups with the mRNA vaccine.
Tim?
I had a different question, but so many people are asking me on Twitter right now, do they have to self-isolate when they go to New Brunswick still? I recognize it's not in your control, but do you know?
I don't know what decisions New Brunswick is making. I would hope that New Brunswick could look at. We have comparable epidemiology. The risks of COVID are very similar in both provinces, but that's a decision ultimately by the New Brunswick government.
Okay, we'll go back to the phones. We have a few minutes left. I'll see how quickly we can get through the list. CTV, Natasha Pace. One question.
Thank you. Just going back to the restrictions that are being lifted. Sorry, I just wanted to make sure I heard properly. So the gathering limit, the general gathering limit is still 10, but now it's being increased province-wide in your household to be 10. Your household plus up to 10 members. Is that correct?
That's correct. So general gathering is still 10. If you go out to dinner with friends or whatever, it's 10. But if you're having people into your home, and this is really about, we heard lots from larger families that they were feeling, and I appreciate that they were feeling an extra layer of restriction. So now we're saying if you're having people into your home, visitors, it's household number plus 10.
Moving on to global. Alicia, do you have a question?
Yeah, this one's for Rankin. I'm just wondering if you can, again, it's kind of going off of Tim Bousquet's question, but why open up the border to New Brunswickers coming into Nova Scotia when we still can't go into New Brunswick without having to self-isolate?
Well, I think we're basically aligning with our policy with PEI. It's up to those provinces and their comfort level whether they would impose self-isolation requirements for people going into their provinces. We had comfort on our end that they have similar epidemiology in low cases as we do. So we're comfortable, we have that, and that decision is up to them.
And moving on to Canadian Press. Keith, do you have a question?
Yeah, I just want to go back to Premier Rankin on that point. Was this discussed at all during your conversations about the overall bubble, and what did New Brunswick say?
It was discussed. I reached out to them once we were looking at the cases drop in New Brunswick. PEI, people have been coming here since the last bubble. And so once New Brunswick started to come down, we started having conversations. And then the whole conversation of Newfoundland being part of it was brought up. So I did notify both New Brunswick and PEI that we would be aligning our policy with the PEI travel in with the New Brunswick because there's no point in making our people, our families, wait when we have the evidence to show that we can open up now.
Quickly moving on to the Herald. John, do you have a question?
Yes, this is for Dr. Strang. There have been complaints about the lack of vaccine clinics on the South Shore. Apparently there's only one, while there are several in areas such as the Annapolis Valley. So I guess the question is, why is there only one down there, and is there a possibility that would be changed given the feedback?
We're opening up pharmacy and physician clinics. We're working with them, and they identified a number of locations. Starting, we had 25 for AstraZeneca, and we're adding more in the coming weeks. And part of it was which clinics had met the criteria of and able to handle the different types of vaccine. Again, what you'll see on Tuesday is what's going to happen over the next number of weeks in terms of a significant increase in the number and the location of clinics around the province.
We have time for one quick question from Victoria at the Coast.
Okay, hi, thank you. I'll try to squeeze it in. This is for Premier Rankin. Discussing the Atlantic bubble, when you were talking about that with the other premiers, this date everyone's been talking about now since, I guess, yesterday, April 19th, is, the anniversary of the Nova Scotia shooting last year. Was there any thought given to that when you picked that date?
That wasn't the date I picked. That was the discussion with all of our teams that would be the latest date, but there's no relevance to that tragic event that started on the 18th and that went into the 19th. Our hope is to open up the bubble sooner if our epidemiology does well, but that's the latest date we're looking at.
That's all the time we have for questions today. Premier?
Thank you. A lot of news today, another day of low case counts, and of course the fact that we are removing border restrictions. Hopefully the easing of these measures will help businesses and families in the Amherst border communities. In addition, lifting the remaining restrictions in place in HRM and surrounding communities, such as the changes to restaurant hours, is another positive step forward as we work toward a post-pandemic recovery. I just want to add one more thing on vaccines. To be clear, because there are a lot of moving pieces, the booking day for people over 80 to book at one of the new 15 pharmacies is actually Tuesday. I think I said Monday in my opening remarks. We encourage everyone to get vaccinated. It's important. Hope everyone's having a great March break week. Have a good weekend. Continue to wash your hands, wear a mask, and keep your distance. Thank you.